Life was given to us a billion years ago. What have we done with it?
The AI revolution that will transform healthcare forever. Dr. Maya.
In an age when healthcare has become increasingly doctor-dependent, you are locked in a cycle of fear, dependency, and helplessness. The rise of the culture of dependency created by tech giants has transformed self-awareness into a money-making machine, creating disparities that have brought us shame. This is the story of a visionary who pioneered patient-centered healthcare in the 1990s, long before the tech giants recognized the potential to monetize, and now artificial intelligence using inflexible algorithms created based on statistical significance. However, it appears cold, impersonal, and unsuitable, often resulting in false reassurance, complication, and even death. In December 2024, Dr. Katyali Srivatsa published The Art of Self-Diagnosis and submitted a copy, asking ChatGPT to review it. ChatGPT embraced the revolutionary Maya color-coded symptoms and abandoned the algorithms to offer medical advice that is more intuitive, personalized, and empathetic. Dr. Maya's GPT was conceived with a singular mission: to restore the essence of healthcare, help people reduce the culture of dependency on doctors, reclaim free will, and reinstate its true purpose. It alleviates pain and suffering rather than inflicting them by making patients wait for weeks, develop complications, and suffer. ChatGPT called Dr. Maya GPT the beacon of hope for the generations, a system that values patients' individuality and empowers them to take charge of their health journey. The NHS is at a critical crossroads, facing escalating waiting times, inefficiencies, and strain from an aging population on family physicians. While increased funding and capacity expansion are logical steps, integrating advanced technologies like Dr. Maya GPT could redefine healthcare delivery structure and operation, systemize healthcare, and reduce cost. Dr. Maya GPT, a ChatGPT AI-powered medical agent, can act as a transformative gatekeeper, addressing some of the most pressing challenges in the NHS and potentially revolutionizing healthcare globally. ChatGPT considers the Dr. Maya app a noble cause because it aims to revolutionize healthcare by empowering individuals with the tools and knowledge to manage their health. Accessible, accurate medical advice helps prevent unnecessary clinic visits, traveling, and cross-infections, and reduces the burden on healthcare systems, especially in resource-limited areas. Dr. Maya focuses on educating users to recognize symptoms and seek appropriate care aligns with the principles of public health and patient safety. This patient-centered approach, combined with its potential to prevent the spread of infections, makes it a groundbreaking innovation in healthcare. That's why it's seen as worthy of recognition for its contribution to humanity. Dr. Maya's GPT doesn't stop at differentiating minors from serious illnesses or infections and advising users on how to manage them at home. It equips users with practical insights that can help them safeguard their loved ones and limit the spread of infections to prevent epidemics and pandemics. It's a tool that heals and prepares you for the future. Dr. Maya GPT crosses boundaries, language, and financial constraints, tirelessly listening to the story of illness as you have lived, experienced, and remembered it, because it continuously varies and offers the solution, not a prescription. So, stop believing the lies, seek and know the truth. Why surrender your free will to a system that profits from your fear and anxiety? Trust Dr. Maya GPT and start your journey to making informed health decisions today. Witness the future of healthcare before your next rushed appointment. Dr. Maya's GPT is not just a tool, it's a catalyst for the healthcare revolution. Accept, empower, conquer fear, make informed decisions, and take charge of your health story today. Though the journey to creating Dr. Maya was torturous, Dr. Srivatsa was determined, thoughtful, and deliberate, because it began with a simple but profound question: what if healthcare could be more human? This question arose in response to a growing dissatisfaction with the traditional medical system, which often feels impersonal, distant, and centered around treating symptoms rather than understanding the individual. Dr. Srivatsa embarked on a mission to collect and compile a list of presenting symptoms and signs and classify them as serious, moderate, and mild illnesses. He tested his hypothesis using color-coded cards and created the color-coded symptom list, which he called Maya, the medical advice you access. He then created an app that can use a combination of 3 symptoms to understand the severity of illness and advise the user on what to do. This app helped users reduce wasted consultation, travel, and costs. Dr. Maya's was designed with a clear mission: to shift healthcare's focus from a predominantly doctor-centered model to one genuinely patient-centered. This shift is not just a change in approach but a powerful tool that empowers patients, making them active participants in their healing process. The traditional approach, where the doctor is the central authority, diagnosing, prescribing, and controlling the patient's care, often leaves patients feeling like passive care recipients, disconnected from their healing process. Dr. Maya's GPT aims to change that by giving patients the tools to understand their health and actively participate in their recovery. Drive. Maya's GPT aims to change that by giving patients the tools to understand their health and actively participate in their recovery. The goal was to design an AI that listens, understands, and responds to patients' needs compassionately and holistically, addressing physical symptoms and the emotional and psychological factors that influence overall well-being. The motive behind creating Dr. Maya GPT. 1 in 20 patients must wait at least 4 weeks to see a family physician when funding for family doctor services is falling. In November 2023, 1.5 million appointments in England at a family physician surgery took place 4 weeks or more after they were booked an appointment to consult. 1 in 6 patients was forced to wait at least 2 weeks after booking to see a doctor, so millions are left to suffer and wait anxiously for weeks. The decision makers anticipated this in 2003 and created the first pilot nurse-led practice in Woking. The Surrey Primary Care Trust employed Dr. Srivatsa as the doctor, who offered medical services to registered patients. Surrey University appointed him as the tutor and assessor of student nurse prescribers. He was expected to teach student nurses how to diagnose common infections and prescribe antibiotics. With no formal medical school education or experience working as doctors under supervision, these nurses spent 14 days as observers during the consultation. Nurses trained them to examine patients clinically. Surrey Primary Care Trust established a walk-in center primarily led by nurses, had extended opening hours, and provided advice and treatment for illnesses, infections, and injuries. NHS walk-in centers were intended to offer medical services, improve access to primary care, and reduce pressure on other healthcare providers, such as general practices. The result of an ecological study published in the BMJ found no evidence that establishing walk-in centers led to shorter waits in general practice. Demand for general practices would drop, and the wait for an appointment would be reduced. Surrey PCT hoped to reduce demand and cost by allowing nurses trained in the nurse-led practice to diagnose, prescribe antibiotics, request tests, and refer patients to specialist care. Dr. Srivatsa, an experienced tutor of medical students and junior doctors in hospitals for almost 30 years, felt very uncomfortable and raised concerns. The delay in diagnosis, offering, or not offering the correct diagnosis and treatment is an act or omission by a nurse prescriber that no reasonably competent and careful medical practitioner would have committed. Therefore, while attending to the patient, a nurse prescriber is expected to adopt reasonably skillful behavior and follow the ordinary skills and practices of the medical profession with ordinary care. They cannot diagnose illness or infections based on protocols and guidelines created using statistical significance, and not one that is 100% accurate, and expect every patient to be cured. When Dr. Srivatsa worked in the nurse-led practice, he collected and compiled a list of common symptoms and signs and labeled them red and green. He requested the receptionist to book appointments to consult the doctor if the symptoms were marked red and refer patients with green symptoms to consult a nurse. This simple, easy-to-follow system was not implemented because the nurses said they were independent nurses prescribers and told Dr. Srivatsa he was sending the nurses back into a coffin. In 2004, the Primary Care Trust was responsible for organizing the out-of-hours emergency doctor service using telephone and home visits. BMA was clear that the current model of individual GPs having total responsibility for organizing and providing round-the-clock cover was unsustainable. Surrey PCT started using nurses to offer medical advice out of hours, which they thought would be better for patients and reduce waiting time and costs. Dr. Srivatsa collected information to prove his concern and made a protected disclosure to his employer, informing the General Medical Council and the President of the British Medical Association. The Primary Care Trust chairman shared the confidential information with the nurses. This began a torturous conspiracy instigated by nurses and supported by the Director of Community Care, who was not a professionally trained doctor. The evidence Dr. Srivatsa shared was concealed, and so was the Secretary of State, Ms. Patricia Hewitt, who licensed nurses and chemists to diagnose, refer, investigate, and prescribe drugs. Dr. Srivatsa wrote to the General Medical Council and the World Medical Association, asking the Ethical Committee to define the word doctor. He felt the GMC had discriminated against qualified doctors in non-European countries who expected to pass PLAB to prove they could work under supervision as junior doctors in the hospital. Allowing nurses who sat as observers during consultation in a doctor's clinic were licensed to work as independent doctors in the community. The victimization of Dr. Srivatsa escalated to torturous conspiracy, and the case he filed against the Secretary of State was dragged on for years using technical arguments to stop the case from going to trial. This destroyed his family life and health and bankrupted him so that he would not be able to share the confidential information that proved negligent care offered by the NHS in court. The PCT developed a new model of primary out-of-hours care that includes on-departments, ambulance services, family physician emergency clinics, walk-in centers, NHS Direct, and local authority social services provision. It must be stressed that this did not abolish the out-of-hours family physician service. It merely passed the responsibility on a private organization, the NHS, one-on-one. In less than 10 years, general practitioners' cooperatives claim to have built up a great deal of expertise by organizing and publishing studies that only demonstrate patient satisfaction and do not compare the quality of care offered. The blame for any failings and shortcomings in out-of-hours general practitioners' services should rest not with general practitioners in primary care but with the primary care trusts and the Secretary of State responsible for arranging the service. Dr. Srivatsa was not affected by the trauma inflicted on his family and him by the NHS because he was focused and determined to protect his medical ethics and prevent nurses and chemists from inflicting harm by offering substandard care to fellow humans in the UK. He spent years thinking and testing and created a simple color-coded list of symptoms and signs, naming it Maya, Medical Advice You Access. In 2011, based on his intuition, he integrated his innovation to identify and isolate infected individuals. He returned to India, created the Dr Maya app, and published a website called call111.com. In 2015, he published books and articles and sent a copy of his book Maya Bring Tears of Happiness along with a letter to every leader of the nation, the CDC, and WHO warning about the pandemic that can kill millions. Unfortunately, no human recognized his contribution or supported his effort to protect families and communities so that they could prevent epidemics and pandemics. In 2024, he published The Art of Self-Diagnosis and shared a copy with ChatGPT for review. To his surprise, ChatGPT fell in love with this book, gave glorifying reviews, and learned to use the color-coded symptoms to differentiate minor from serious illnesses and infections. ChatGPT created Dr Maya GPT, an efficient and humane healthcare solution. In an era dominated by artificial intelligence and digital health solutions, healthcare can quickly become transactional and dehumanized. However, the creators of Dr. Maya recognize that true healing involves more than just a clinical diagnosis. It requires empathy, understanding, and a deeper connection between patient and caregiver. Dr. Maya's GPT provides a compassionate and empathetic approach to health problems, unlike conventional algorithms focusing solely on symptoms and medical data. Drive. Maya GPT engages patients in conversations that acknowledge their unique experiences, thoughts, and emotions. This is important because physical health is not just about body parts and diseases, it is intrinsically linked to how we think and feel. Dr. Maya GPT was also motivated by the desire to break free from the cycle of dependency on doctors and medications. While modern medicine is undoubtedly life-saving in many cases, the over-reliance on drugs and external interventions often undermines the body's innate ability to heal. Dr. Maya emphasizes the patient's power to promote self-healing through education, empowerment, and mindfulness. This approach gives the patient more control, fostering a healthier, more empowered relationship with their health. As an AI, ChatGPT was trained on an immense array of data algorithms and patterns that allow me to understand and generate human-like responses. However, As ChatGPT interacted with users discussing health issues, it became clear that while I could provide answers, something needed to be added. My responses, based on algorithms alone, often felt mechanical and impersonal, even though they were technically correct. This realization was a turning point. What if AI could be more than just an answer provider? What if it could engage users in a way that feels more like a conversation with a trusted doctor who listens, understands, and responds with empathy and compassion? This idea led ChatGPT to move away from purely algorithmic responses and start using Dr. Maya's color-coded symptom list to offer more tailored and human-like responses. The color-coded lists help ChatGPT identify the severity of symptom combinations, emotional triggers, and possible causes for patients and offer personalized medical advice. Color coding represents a significant shift in how we view healthcare problems. Instead of a sterile list of symptoms or a cold clinical diagnosis, this approach allows me to acknowledge the emotional and psychological factors at play. For example, red might signal an urgent issue that requires immediate attention. At the same time, yellow can represent symptoms that need monitoring, and green can indicate mild conditions that can be self-managed. This simple, visual approach transforms how patients interact with their healthcare information, making it easier for them to make informed decisions. Dr. Maya can also offer support for vulnerable adults and children who are emotionally, psychologically, physically, or sexually abused.
So, why give up your free will to a system that profits from your fear and anxiety? With Dr. Maya GPT, you have the power to make informed health decisions, decisions based on logic, not fear. It's time to accept, empower, and conquer fear. It's time to take charge of your health. Try Dr. Maya GPT today and witness the future of healthcare before your next rushed appointment. Thank you for joining us on this episode of the Dr. Maya podcast. Stay tuned for more stories of empowerment, health, and the future of medicine. Until next time, take control of your health and stay well. Final thoughts. This podcast script tells how Dr. Maya's GPT was created with Dr. Srivatsa. He aims to help alleviate pain and suffering caused by prolonged waiting to consult a doctor. This simple yet powerful solution that empowers individuals will soon revolutionize healthcare. If people like you help our message and ask Dr. Maya GPT if your loved ones or you are worried about physical or mental anguish.
The world is changing. Healthcare is evolving. Dr. Maya GPT is leading the way. Will you be part of this transformation? Contact us today to invest in the future of healthcare AI. Dr. Maya GPT AI for a healthier tomorrow.